Mickey,
Yes.
Euclid Hall was vaccinated today. Can you imagine?
I thought it was Friday, last Friday. You sure it was today?
I spoke to Sherry. She said today.
Okay, I think they finished today. Yeah.
Yeah, that's probably it. Yeah,
So we're all done for a while now.
it's amazing. Amazing.
So Shelley, what do you want me to talk about?
Okay, talk about why you, what made you decide to take the shot,
Okay,
right? How you felt about taking the shot,
okay.
right? And how you feel afterwards about encouraging others. Yep, exactly. Yep.
We're waiting for a politician?
The assembly member, yeah.
Hi, Tommy.
Hi, Tommy.
Hey, Shelley.
Hi,
Hi.
Tom.
And then Tommy.
Nice to meet you instead of texting.
Yeah, exactly. Indeed.
Tommy, the assembly member has his own link, or should
Yeah, he does.
I? Okay.
Yes, I will check with him.
And there's our first interpreter signing in.
This
Hello,
is the first for
good
us.
afternoon.
Hello, Ms. Jurado.
Hi, how are you?
Okay.
I believe Ruby should be joining us as well.
Sure.
I see we're on live.
So I just started the interpretation. Interpretation is not available. And the interpreter can speak in Spanish on their channel. And for anyone that wants to hear the interpretation in Spanish, they have to click the interpretation icon on the bottom of the screen and select the Spanish channel.
Robert wants to know whether he can enter.
He means can he be made a panelist?
Ah.
Several colleagues that are in the same situation. Shelley, I don't know how you want to
You
handle the
can't
meeting.
distinguish. No, we can't distinguish. We can't give preferential treatment.
You know, Mark, for the first time I was an attendee yesterday in a webinar instead of a panelist.
I didn't hear that.
Yeah, it's a different experience.
A
It really
different
is.
experience, yes. It was the one with Schumer.
Oh, I missed that one.
Well, actually, no, the one last night. You were a panelist.
Yeah, I helped set up the first of those
Right.
panel discussions, so they
Right.
made me a panelist that
Yeah.
time. Probably shouldn't have been. Probably should have been somebody else, but I wasn't going to argue with him in the middle of,
Right.
of a panel discussion.
Tommy, do you know if the assembly member may be delayed in a different event?
Yeah, he's in conference right now, so we'll just, I believe he should be here in a moment.
Yeah, the budget's due tomorrow, so I imagine he's a busy
Right.
guy.
A little bit.
Yes, Ms. Jurado, we started yet, since you're the interpreter, when you speak in Spanish, whoever joins that channel will hear you in Spanish. But we haven't started the actual event yet. We're waiting for the assembly member to join us before we actually start. we'll let you know when we started.
It's amazing how Christian can do all this from Puerto Rico.
Ay,
That's cool. What town are you in?
I'm home. I'm here in New York. I wish I was in the beach. I'll tell you.
That's his background, but
El-
the trees are, the wind's blowing on the trees.
I wish I was in the Conquistador or something like that.
Okay.
Here's the assembly member.
Danny, you're muted.
There we go. Friendly faces. Was not seen in a long time.
Hello, Danny. How are you?
I'm good, my dear friend. How are you?
I'm very good.
We are in Albany trying to do the budget, and that is not pleasant.
I don't imagine so.
Yeah, no, it's not pleasant. You would have thought that with $15 billion from the feds, we'd be able to solve some problems, but apparently not. So
Tommy, whenever you want to start.
Thomas, are you there?
Yeah, I'm right here.
Okay, Tommy, you go.
All right. Thank you, everyone, for coming. I'm glad that we could pull this together this evening. We will be having, tonight we're joined by Dr. Julian Watkins, who will be sharing some information with us about the vaccine. We're also joined by Assembly Member Danny O'Donnell, who is sponsoring this event in joint effort with Community Board 7. So I will go, and then Danny will, Assemblyman O'Donnell will say a brief word, followed by Mickey Navarro, the director of the Red Oak Senior Center, will share her experience with getting the vaccine, how she's feeling, how that went for her. Sheldon Fine of CB7 will share some resources on how to get a shot in the area and anything else he finds that's been helpful in helping people out. And then Dr. Julian Watkins will present for about 15 to 30 minutes, followed by a Q&A. So, Assemblyman, if you want to go.
Thank you, Tommy. Good evening, everyone. I'm sorry I can't be with you in person, which would be my preference. I am outside of Albany, where we are in the process of finalizing the budget. And so I will talk, and then I will go on mute and wait to see if I have to turn this off to go back into conference to discuss the budget. I too have been received both shots, both Pfizer shots. I must admit the second one was not pleasant the next day, but I survived that. It was a minor inconvenience compared to what could happen. I have a number of dear friends who died, which is very disturbing to me. And I understand that there's a lot of hesitancy and nervousness about vaccines in general, but this vaccine in particular. I mostly want to thank Community Board 7 for being so diligent in helping me with this, and particularly Shelley Fine and Madeline Innocent, who are true community activists. And it was Madeline who said, can't we do this and get some doctors and knowledgeable people to explain it all to us? And I said, sure we can, by which I mean my staff can do that for me. So they have done that for me. And I will stop talking, but I will continue to listen until I have to go somewhere else. So thank you for being here. Thank you for the Department of Health for coming. And I hope this is a very elucidating evening of information about why it's necessary for our community to be vaccinated. Thank you.
Okay, so I go. So I just want to take a second, please indulge me, because we have a politician on board. I want to denounce the violence that is against our Asian community, especially the seniors who are part of my senior center and our residents in our Wishfish buildings. Okay, so I got that on my system so that you could hear it, that we are in a battle to secure our aging population in our community in Manhattan Valley. So I have a master's in social work, and my primary studies was mostly with senior citizens. And I'm like a research junkie. I enjoy listening to scientists that have a lot of information to prepare us for anything that's going on. And doctors, love doctors and nurses. And I work for WISHFISH, Westside Federation for Seniors and Supportive Housing, where I run 2 senior centers, one in Douglas Housing and one in West 106th Street. And we have a very dynamic executive director who very early on ordered a great deal, big number of Pfizer vaccines way before anybody did it. So by January, we had about 1,000 in our stockpile. And we heard our seniors. As a senior director, I started out with 900 seniors members from both centers, and Department of Aging is also someone that I have to account from. And so they would give us scripts, and we went out there and we called 724 members every 2 weeks. And by the end of the month, we were calling the 900, and now we're only down to close to 700 members. We know quite a number of them died from COVID. We are missing a lot of them. We think a lot of their children took a number of them. And so we are now, because we're all vaccinated, because we have more freedom, I believe, and we are now tracking and our seniors that are missing. So back to Paul Freychak, who is our executive director. He gathered together all the social workers and staff members to decide how we were going to convince or we did a campaign on vaccine trust and how we were going to convince the seniors in huge numbers. They were saying to us that they were not going to accept a vaccine. So our campaign was to present ourselves, people who they trust, to say that we believed in it. But before we did that, our executive director had meetings just like this one, where he brought in professional doctors, scientists, and nurses, and other people who do research scientists, and they instructed us, and they convinced us that this was the only way to go, that this is all we had to try to go into the new normal and to move forward. And so we accepted that. And I definitely believe that this was the way to go. I remember campaigns, reading about campaigns against polio. Dating myself, I'm a senior citizen. I remember going to school with a student who had polio. And I remember parents crying and talking about asking the government, how are you going to help us? We don't want our kids to fall to this disease. And then the vaccine came. And, and I do know that vaccine, there's still polio around, and that it's not safe completely, just that the same way that this may not be. We're going to find out about these vaccines later on. But we saw it as a way out, a way to come back to some sort of normal, and to begin to open our city up, and to become, like, for instance, every phone call we made, the seniors wanted to come back to the center. Mickey, when are you going to open the center? We missed dancing, we missed bingo, we missed all the activities, the Zumba, all of that. Well, then we began to say, we think that the best way to come back to this is by accepting this vaccine. They still weren't doing anything. So our final decision that really worked was that the social workers and staff members whom these residents trust, we would get the vaccines first, and we would be photographed. And then we did that. And my first vaccine was January 15th. And then by the end of that week, there were posters in all of our buildings with our faces and our injection right into the arm. And so then the calls began to, as we made phone calls, they began to agree that this is the best thing, and they were signing up in numbers. Right now, as of, I think yesterday, we've administered 1,600 vaccines. So we have 1,600 people who are vaccinated and hopefully immune to this deadly disease. And the way that we did it is we also walked around with this sticker that was created by Wishfish. And it said that we were vaccinated. And they saw that, they trusted. They also kind of waited maybe a week or two to see if we dropped dead, to see how we were doing. And so we did videos and we called them really, excited, and we were honest. I had the same day I took the first vaccine on the 15th of January, by 2 hours later, my arm hurt. It felt sore, but I take the flu shot every year, and that's the side effect I get from the flu shot anyway. So I sort of expected that. I didn't like it. And so but you do what you got to do. Everybody gave you a remedy. They'll say, rub it, put some hot pot, hot compost. Everybody has something to advise you at. I just rubbed it. Anyway, so then in February 5th, it was the second one. This was a little different. This, by the end of the day, not only did my arm felt sore, but I felt like I had to go to fatigue, big time fatigue. And I felt achy. I was really achy with no fever. But I went to bed early. I went to bed about 6 o'clock and slept through. And the following morning, about 7 o'clock, I woke up really feeling good. And then some of the research that, and maybe Dr. Wilkins can verify this, is that we were told that it would take about 2 weeks before this whole vaccination worked, and when you feel really immune to a degree. So we kind of peddled that a little bit, but lightly, because we weren't sure where that was coming. The experts hadn't told us that, but we were peddling that around a little bit. And then what happens, some of this stuff gets into your psychic, some of it is good for the psychic, because if you think, oh, in 2 weeks, I'm going to be really immune, but yes, I have to continue to do PPE, and I have to keep myself safe and distance from others, because not everybody has it. Plus, we don't know, there's a lot unknown roads that we have to travel before. So, but there is something going on when you put the message out there. Like I said, it's almost like a psychic thing, where I definitely feel I have more freedom. I'm still very guarded. There's still no kissing, no hugging, and that I'm a kisser and I'm a hugger. And there's still none of that. And there is now it's a 3-foot distance, so I could go like that to the members and give them that kind of a greeting. But still, the mask is on, maybe a double mask, and still I'm cautious, and I remind the seniors and the staff members to be cautious, not to let our guard down. But there is a sense of relief now, honestly, after the injection. That's how much we believe in it, or I believe in it. And there is, like I said, there's more of a sense of freedom, in terms that I'm stepping out more into places that I had not gone to, had missed going to before. So that's been my experience. I could circle back to other passages that we all had to go at Wishfish. We have an absolutely amazing story on the heroes that I work with. And, there's a great story that maybe Shelley wants to talk about later, about how we evacuated hotels and all the lives that we actually saved in removing them from infected buildings once they got infected. So anyway, I'm grateful. one of the things that I'm find myself really grateful about is that Wish has made it so easy for us to get vaccinated, because in the street and everywhere I go, and the phone calls I would make, the challenges that these seniors went to, if had to go to be vaccinated, that were not members of the Wishfish family, but are my community from Douglas, my community at the senior center. I finally was able to get them up to the Armory. A lot of them, I got 84 people into the Armory, because the Armory was one of those places that you walk in and you're a senior and you didn't need an appointment, and they would do all the application, all the paperwork for you. So I found that spot as early as de Blasio announced it, and I sent seniors up there, but the only seniors who could go up there were the mobile seniors. And so there were lots of seniors that were immobile, and also seniors that didn't have ways to get them there. So I started to create groups, and that was very challenging, because we don't know, I couldn't create big groups because we don't know if there were carriers. We don't know, you have to keep the distance. And so we don't know if we were going to inflict them with the virus, because we don't know what their conditions were. So that was really challenging, but all of that has died down, and I think it's within my community, which is the Manhattan Valley community. But I do hear stories from the Douglas Senior Center, the Douglas community. I mean, I get some people tell me they're visiting in their homes and they're being vaccinated, and other people saying they're not doing it. So. That's another thing that we need to get to. So I'm going to leave it there for you, Shelley. You want to take it from there?
That was great. Thank you, Nikki. In addition to being co-chair of the Health and Human Services Committee from Community Board, I'm president of the West Side Federation. So I knew all this was going on, and I was saying, this is wonderful. What about all the other people, especially the seniors initially? So I studied what went on. Of course, the best way was in our lobbies, in our community centers, we had the shots done. It wasn't going to happen. The city wasn't moving in that direction. So I started studying what was out there, okay, and found certain things, found eventually websites, impossible to negotiate. But somehow, as a first responder, I ended up getting a shot in early January, and by February 2nd, I had my second shot. Feeling a little guilty that I was, although correctly vaccinated, what can I do? So I started studying everything, and as it evolved. What I came up with was an ability to, it's now for the last 2 months, an average of 44 people, getting them signed up, either by doing it for them or doing it with them. I want to point out some of the things that I've learned right away. Right now, there are no shots at Mount Sinai. Okay, they had them today, but they have no new ones except for one person I know who was able to get it. And why don't they? Because there's a strange system of distribution. One day, say Mount Sinai had all the vaccines for everybody, come and get them. And the next day it was in Javits Center, okay? Walgreens was a treasure trove of appointments. I went on, I was getting, in February, got people appointments left and right. Go to this drugstore, that drugstore, 102nd Street, 106th Street, 90s. It was terrific. Today, try getting one. It's nearly impossible. Okay, no appointments, second doses only, et cetera, et cetera. So what do? Okay, you go on Vaccine Finder, and certain things happen certain days, some things don't happen. So this is what I learned. First of all, most sites don't know what they're getting until the beginning of a week, a month, say a Monday. So they don't make appointments for Monday. The appointments are Tuesday, Wednesday, Thursday, but the second that comes out, they're gone before you know them. So what I started doing is is getting ready on Tuesday morning to sign people up, and got a whole bunch. Okay, and then some on Wednesday, and then the situation fell apart. The people generally were elderly people, disabled people, grocery store workers, and food delivery volunteers. And so became a successful thing. A part of it is jumping around and trying everything and going back, and some of it is experience. But these are the things that hampered people from getting it, okay, despite the fact that was able to begin to facilitate it. First of all, they needed proof of age, okay? So some people said, you don't need it. I went, no one asked me for anything. But they can ask you for proof. So you need a driver's license, a non-driver ID, an ID NYC is okay. Passport, it could be foreign, it could be domestic. Proof of residency. So some people said don't have it. A rent receipt, a letter from your landlord. Both might be difficult. So you try whatever you can do. Something that has that. Letters you received, if they ask for it. Proof of comorbidities, underlying problems. You have to have a doctor's letter or a signed certificate for it. You just can't say, I have this or I have that. And if a person's under 18, especially now, what's going on, they're going to have parental consent. There's a need to check with your health provider. Some people said, I don't know, I have allergies. And they said allergies, well, what allergies? Initially, I heard allergies to vaccines, but I've heard otherwise. So you have to check with your health provider. Some people don't have a regular health provider. That can cause a problem. You don't want to do something. Or you have your immunocompromised or on a medicine that affects your immune system. You just can't walk in and say, I'm the right age and this and that. You want to look out for yourself. Are you pregnant or planning to become pregnant? Have you received another COVID-19 vaccine? Okay. And it's not good. It's not interchangeable. You can't have one and then take another one. As I said, Mount Sinai is not a good place. It was a great place. Maybe next week it'll return. There are pop-up sites that come here and there and everywhere. And somehow people know about them, and sometimes places people don't know about them. And it's a wasteful thing. It's still not well organized. We suggested from our community board that there be like a hotel, Travelocity, Priceline thing. You go on or you call, you give them the information and they give you the appointment. It's not like that. You have to know something. You have to answer the questions. You have to file. So what do I suggest? Number one, also Walgreens and Duane Reade are great. And even when they had it, no signs on the outside of the pharmacy saying we have vaccines.
But they do.
You know, I knew they did. I sent people in. They signed up on the spot at one point. Maybe it'll happen again. Number one, either on your own or otherwise, you have to go on multiple sites. Okay, you go on the Mount Sinai. Oh, if you are associated with a hospital, you contact that hospital. As of a couple of days ago, NYU started contacting its people. Other hospitals will when they have it. So that's a good one if you have one. But the other thing is you have to go on multiple sites. You have to sign up, even if they don't have an appointment there. You can come back to it. If you're registered already, you're better off than if you're not. I know people who like 6 weeks later, all of a sudden got an appointment. They didn't remember they went on. But then there are people who are having a lot of problems negotiating and not people who are technologically challenged. These are people who know technology even, and they just can't figure out what to do next and where to go.
It wasn't senior friendly. It isn't senior friendly.
No, it's not senior friendly. It's not user friendly. It's user unfriendly, even for younger people. Okay, but especially we shouldn't make generalizations about seniors, but many seniors have difficulty with it, okay? It's like not meant, and you try calling the number, I can give you the number, but I spent an hour with the phone on speaker trying to go on the computer to try to figure out. So this is an offer that'll last from Monday of next week to Thursday of next week. I'm gonna give my my email, and people who either want to sign up but aren't able to because they don't know how to use the system, or if they want to do it together, where I'll be on the computer and they can be on their computer and go through things, I will make myself available during that time. The average of 44 successes are because I've accumulated all this knowledge, sat on many Zoom meetings with the city, with the borough and other places, but also played around with it so long now that I have a good record. But it'll be better to have a partner than not to have a partner. Like, think of it as a coach. So that email is easy, SFINE, SFINE, 50 at AOL, SFINE50 at AOL. And don't hesitate. And it may just be, you need 5 minutes. You can have an hour, okay? And even if we can't get it, which, you know, is always a possibility, you'll maybe that much closer to getting it. The last thing I want to say is people saying, I only want this vaccine and not that vaccine for whatever reason. My suggestion is whatever one you can get first, get. Because the fact is, people are talking about herd immunity. Herd immunity is not happening until we have between 70 and 90% vaccinated. And whatever herd immunity ultimately means, that we're likely to go back to a much more normal situation, but not for political reasons, but because we'll be safe. And that's what we have to work towards. We have a responsibility for ourselves and our families and those around us, and those who have hesitations. I've spoken to people, including in our buildings, who have said, I'm never going to take a vaccine. I said, what are you going to do? I'll stay in my room forever. And so, you know, there are people who have, because of cultural reasons, historical reasons, fears. They need to be spoken to and to be cared about, okay? And not to be criticized, but we should try to educate as many people as we know what we've learned and the fact that we're better off vaccinated than not vaccinated for ourselves and our community. Thank you.
Okay, thank you. And I guess Dr. Watkins, if you'd like to do your presentation.
Sure, we can go ahead and get started. Miss Madeline, we'll have you. I'll be quick, and I'll call you first. Okay.
I was going to share my screen for Dr. Watkins, and I don't have that capability. Can someone make me a host? Is that possible?
I just turned that on, so you should have it now. Try it again.
Thank you so much. Oh, here I am. Okay.
As we start sharing, my name is Julian Watkins. I'm an internal medicine trained doctor at the health department. I used to be the physician in charge at the Riverside Sexual Health Clinic up on West 100th Street by the library. But then when the clinic closed, I went full-time for COVID work. And so here I am. I work for part of the clinical overall city response around COVID. And I also work in what we call vaccine equity to really address some of the concerns and lack of confidence that folks may have in the vaccine and these larger systems. So I'll just cover some of the vaccine basics and then we can get into some question and answer, because I want to make sure that we can, for folks who do have questions, I hope I can address them. the number one thing that I really want folks to understand is the vaccines are safe and they've undergone rigorous testing. They've been some of the most tested and most vigorously monitored vaccines that are in existence. The vaccines are building on years and years of understanding of how our bodies and immune systems work, and also building on knowledge about vaccines around similar types of viruses, specifically like respiratory viruses. The vaccines are recommended. We recommend folks get vaccinated if they're 65 and up. We recommend folks to get vaccinated if they have underlying conditions. We even recommend folks get vaccinated if they've had COVID and recovered from COVID, or if they were found to have antibodies at any point over the last 12 months. Understanding that sometimes antibodies can fade. We've seen that from folks who overcome COVID, and also just understanding that folks who are a bit more mature and who may have underlying health conditions have unfortunately had some worse outcomes from getting infected and have really been bore the brunt of this pandemic in the United States. I want folks to understand that the vaccines are not only are safe, but they do not contain the virus that causes COVID-19. The virus that causes COVID-19 is called SARS-CoV-2. None of that virus or any particles related to it are in the vaccine. What's in the vaccine is actually genetic material that was synthesized in labs that helps our bodies encode for a very particular type of protein. Or using our body's natural machinery, the vaccines help our body make a protein that basically uses a protein that COVID-19 uses against us. We get to flip the script on COVID-19, or the virus that causes it. And getting vaccinated helps our body produce that protein, so that our immune system can recognize that protein and can actually make antibodies for that protein. So if we come in contact with that protein in its natural state, when it's a part of the bigger viral particle that causes the illness, our bodies are prepped and ready to go to defend and protect us from the illness of COVID-19. Some folks have been asking if these vaccines alter our DNA, or if the vaccines have microchips or any other things that we don't want. And luckily, even though they are technologically advanced, they are not that advanced, and they do not contain any microchips, and they are not able to alter our DNA. As I said a little bit before, with this great understanding of how the immune system works, we're able to use our body's own mRNA systems. mRNA is one of the building blocks of life that works with our regular DNA, and it's kind of how our bodies are able to express our DNA. So our DNA carries a code, but the mRNA that our bodies have are actually translating that code and helping us be the height we are, give us our skin tone, give us our hair texture, all of that. And so, our bodies are well equipped with handling mRNA and DNA because we have it our own, and we have systems to basically break down the mRNA when it's done running its course, and the same thing with the vaccines. So just a quick summary, there are 3 vaccines that are currently approved. The 2 mRNA vaccines are called Pfizer and Moderna, as folks have graciously shared already. Those are the 2-dose regimens, and as folks may or may not know, it's you get the Pfizer between 21 to 42 days after the first dose. For Moderna, 28 to 42 days after the first dose. Those vaccines are out for a bit longer. They've been out in circulation, and there's a large supply of those, and we'll talk about supply in the next slide. And then Johnson & Johnson, which is a bit newer, it's been since it's more recently in production. This 1-dose regimen, and we're slowly be able to increase the production. And next week, there'll actually be about 1 million doses sent out nationwide. Since it first got approved, the distribution has been a lot lower, about 2 million doses spread across our big country. So we'll definitely see a big a lot more availability in the coming weeks. And as folks have shared, after folks do get vaccinated, it is important that folks continue to wear face coverings and keep our physical distance and limit gatherings, because we do know the city is tracking these variants. And there are some variants of concern that have been shown to be more easily transmittable or able to pass from person to person. So we really want to make sure that we minimize spread of the variants. And as we learn more about how these variants interact with our vaccines, it's important that we kind of still practice these safety measures. So we can start, it does give some light at the end of the tunnel. We do see that there is protection in light of the variants, but we see that more variants can develop. And so I think as we keep going forward, just to kind of be mindful and not lose sight that there are some things that can continue to protect us until we know for sure that it's safe, which are those core four, covering your face, getting tested, physical distance. Next slide, please. Shelly talked a little bit about the vaccine, how it gets to the city. So basically, yeah, we get our supply from the federal government. It's more centralized in a way and all of our shipments are on a weekly basis, and they are shipped to the state and to the city. And then the city is basically helping to organize distribution across the city. So New York City has a very particular makeup. As folks know, if we were a state, we'd be about the 12th largest state in the country, but we are a city, and we are within the jurisdiction of the state. And so, a lot of our vaccine program is the city has to follow the lead of the state. And that's why folks can see that there may be some inconsistencies across city-run sites versus some state sites, because the folks who are in control of the state sites are, they answer to a different person. We do try to communicate and we do try to make it as uniform as possible, but again, we can't control what folks in Albany say. But we try to work together to make sure that we do have vaccine equitably distributed. Next slide. Talking about distribution and eligibility, unfortunately, because the supply was low and did not meet the demand of folks who want the vaccine in New York City, we've had to have what we call a phased distribution. And we basically have to prioritize folks based on their risk. And so that's why folks saw earlier, was like folks who were 75 and up, folks who were working in hospitals and who were like frontline. All of that's because it's about folks who are at the highest risk of being infected, but by where they work, where they live, and folks who are at the highest risk of dying or having severe symptoms from COVID, and that's by age and medical conditions. And as more and more folks have been vaccinated, and as more and more folks have been able to actually start get appointments, they've been able to expand it. These expansions are all dictated by New York State. So it's not perfect, and it's not necessarily based on what's going on in New York City, but New York City is definitely trying to respond in as quick a manner as possible. These weekly doses do arrive to the city around Mondays, and they try to open up the appointments as soon as possible. So right now, folks, any adult who's 30 years old and up, regardless of medical condition, regardless of where they live or work, anyone who's 30 and up can get vaccinated in New York City, at the New York City sites, at the pharmacy sites. And then on the screen, you can see some other reasons why folks may be able to get vaccinated if they're under 30, but anyone who's over 30, that's all you need. And the New York City Department of Health website does have information for folks who may not have an ID or may not have a New York City ID. There's other ways that folks can get vaccinated, because we want to make sure that the vaccine is free and readily available to all New Yorkers, regardless of their immigration status or regardless of their insurance status. Starting next week, Tuesday, actually, folks who are 16 and older will all be able to be vaccinated. And I think that's also really important as we are moving our society to having a lot of folks and a majority of the population vaccinated and safe and protected from this virus. In fact, vaccinating children is a high priority. So in the coming months, folks will see that people younger than 16 There will be data talking about safety and efficacy. We saw some recent report from Pfizer talking about safety and efficacy in kids. All of that data wasn't released, but that should be coming soon. So school-age children may actually be able to be vaccinated before the new school year. There's also studies underway for people who are younger than 16, starting at 6 months through 12 years old. There are studies underway. There's also studies underway for people who are pregnant. So there's a lot of research and things coming down the line. I think that as we get higher supply and more eligibility, folks hopefully will not have to be dealing with some of these scheduling and availability problems in the coming months, because we'll actually be able to meet the demand, and folks will hopefully be able to go to their regular doctors, go to their local pharmacies, or wherever they get their normal medical care. So hopefully this is just a frustrating, very short time. We'll have a lot more vaccine available in the coming months, and I hope, and that's something that we can all look forward to. With that, let's open up the floor for any questions.
This is Madeline Innocent. I'm going to tell you a little bit about my experience with the vaccine, and then go on from there. But even with the flu shot, I didn't even want that. My doctor had to convince me that I'm in my 60s, so I should get the flu shot. So it took me years to agree to that. So the vaccine, I knew was coming forward. What I said was, I let others go first, and this is what other people are telling me as well. They'll let others go first and see if how it affects them. It took me a while, but then I thought about this. I go outside, and I live in Douglas houses. Not many people wear masks. So, and I constantly got in confrontations with people, asking them, well, you're out of here with no mask, and what about you going home to your family and giving it to your family? Don't you care? I don't know if they don't care. They don't believe COVID is serious in Douglas. I've spoken to young men, older men. They don't believe it. And your presentation, doctor, was marvelous. But the experiences I am experiencing in Douglas houses, that's not going to weigh on them, because they don't even believe it's the Trump syndrome. It's a hoax. And so that's when my conversation stopped. However, Mickey, I might need you on this. There's many Hispanic people not understanding. They don't have a computer. They don't have anyone to have access to it. These last few days, I've been having to get somebody to translate it in Spanish. Oh no, I'm waiting for my doctor. I'm waiting for my doctor. But then find out in Spanish, they didn't know how to access it. They didn't have no access to computer. I went to get my first shot in Walgreens on 94th Street. A woman walked in. She said she had an appointment. Find out she didn't. So I tried to talk to her. I said, you know where a senior center is? And this has to be broken down. And I'm not going to say like a 2-year-old, but it has to be broken down where they can comprehend it. Presentations, the COVIDity, all of that stuff, they don't understand. And Mickey, and maybe you, we have a lot of Hispanics in my building alone, 865 Columbus, that we can knock on doors and talk to people, tell them where to go, have flyers. We don't have any of that. We're winging it as I see it. But
I agree with everything you're saying. We've taken care of those seniors who are members of our center, that we could reach out to them. We've made their appointments for them. We've walked them through everything, including bringing in the city. I called the city. I got a call back from Levine's office, and he helped me reach out to people to bring them to sites. I think one of the meetings I was in today was Department of the Aging, and what they're encouraging us to do now is for those centers who have vans to make trips, to create trips and bring them to the sites. But But that's a little, doctor, I mean, that's a little iffy there. I don't know who I am, how many people I could gather together, and I don't know if they're going to be carriers, if they're carriers, if they're going to infect other people.
Exactly.
So we're just starting to look into that area. I'm willing to get a crew together to go into Douglas, but Douglas doesn't have anything set up. They don't have vaccines. I suggested to Levine, or maybe I should have gone to O'Donnell, that they should have a hub in there. I have a senior center in there. You could take over that senior center and use it for vaccination.
Well, that's what I suggested to Tommy.
Whatever it is you need within my power, so that you could come in, and I will have my staff go in and help them too. Most of my staff is bilingual.
And we can fly in Douglas houses, because it's getting horrendous here. I get in the elevator with people with no masks. I was so frightened before I got my shot. I'm a little braver now, but regardless of that, I want to tell them it's not safe. It'll be 5 people in the elevator with no mask on, and I just pushed my way out.
Listen, for those of you who don't know Douglas, sorry, Matt. For those of you who don't know Douglas, Douglas is in the middle of an area that's been vaccinated. You go, I'm on West 97th Street. Douglas ends on 100th Street. My area has been vaccinated down to where you live, Shelley. And then uptown, they've been taken care of too. Up Washington Heights and the area where Columbia University is, they've been taken care of too. They're stuck in talk about equality. Talk about that.
And may I say, Mickey, that we pointed this out over and over. 10025 is well vaccinated and otherwise, but not Douglas.
Exactly.
And because we're not a low-level vaccinated, high incident area, we're ignored because it's being done by zip code. And our zip code, Douglas residents suffer because they're in a good zip code.
Well, in all fairness, Shelley, I've had people, they just outright don't want it. I've been threatened.
I get it. But at least you can offer the opportunity, and the test and trace people said they will go out and they will educate, they'll have programs, they'll do things. It needs to be a multifaceted effort and not just show up one day with a pop-up site.
Exactly.
But also what Wishfish did. I mean, we have
excuse me. Allow me to interrupt.
I'm sorry.
Tommy just indicated that Dr. Watkins' time is limited, so let's get to some questions from the rest of the attendees, and so that he gets a chance to answer them.
Well,
Okay?
that was my question to him. How do we reach people who are resistant to it? Like I say, your presentation was beautiful, and we all understand it. But the average person lives in Douglas doesn't, and we can't reach them. What do you suggest?
I mean, folks kind of touched on it. It's a multi-system approach. I think folks probably need a community day, talk to your local, political folks who organize this, the assembly member, talk to the borough president. I'm in regular communication with the borough president, getting folks to kind of bring, you have to get the folks involved, let folks know that there's a thing coming so you can actually spread the message. And I think there is a way to kind of bring in some focused attention to some of the housing. But I think, it's some community advocacy. I see there's a couple questions in the chat that I wanted to respond to. It was Marie, you have your hand raised. If you mind, can she be unmuted?
Yeah, give me a second. So for folks that want to ask questions, use the raise hand function, and we will call on you one at a time. We will call on Marie first, and then we will follow it after that. Hold on. Oh, we lost Marie.
Well, she typed in the Q&A box. I'm 66 years old. I'm immunocompromised. I've had COVID, and I was told I only need 1 shot. I want the J&J and can't find it anywhere. What can I do?
Yeah. So in the United States, we are not doing one shot if it's not J&J, we're not doing one shot if you previously had COVID. So that's number one. If someone is specifically waiting for J&J in the coming weeks, there will be a lot more available. Again, it's been like a little bit over 2 million across the whole country. They're going to have 11 million come out. So that's going to be a big increase. But I would say if you can't find it, I would not wait just for the specific thing because it is a limited resource. I think it would be better to get that process started with what's available. And then at least as you wait for your second dose in the coming 3 to 4 weeks, you'll still have a level of protection because after you get that first dose of the of the mRNA vaccines, you do get a level of protection. So in that 4 weeks, you get about like 50+% protection. I saw that Mr. Espier had raised his hand.
Okay, thank you, Doctor. My dear friend Rosemary, she's my age. She's 78 years old. She's got several comorbidities in your language. And early on in this whole experience, she caught what she thought was the flu. So she did the Theraflu and all that stuff, got a lot of sleep, a lot of liquids and the whole thing, and it ran its course. Then the shots became available. She had both shots. I think the last one was at least 6-7 weeks ago. Now, since then, she has had what, in our discussion, are terrible side effects, including hives. She checked with her PCP, and he said the chances are that what she thought was the flu was COVID, and the vaccines are presently now fighting. Are those the antibodies? They're in there fighting, and in 2 or 3 weeks, she'll recover fully, and the symptoms will go away from the reactions. What about that? Is that are you treating that? Is that accurate? But don't forget, she has several comorbidities. She's on in years. She's got a bunch of stuff.
Yeah. So I would say, unfortunately, for very specific case and individual like health issues, I don't know the full picture. It will be hard to speak to that. But what I will say is that folks who previously had COVID, they should still get vaccinated. I would say that the incidence of severe side effects from the vaccine are extremely rare. All these vaccines, basically, it's up to like between 5 to 6 severe allergic reactions, which we call anaphylaxis, or your throat closing up, your face swelling up. That's extremely rare. It's about 4 to 6 cases per million. So in New York City, about a little bit over 3.5 million doses have been given. That comes out to about 15 people in a city of over 8 million, right? So very rare, very well monitored. The CDC and the FDA is investigating anything that does sound fishy. They're investigating stuff to make sure and they're doing like these more focused investigations to kind of get more of those specific medical histories. So I would recommend for your friend.
Where should I tell her to go? Thank you.
Recommend that your friend follow up with whoever is following her for these medical conditions and follow their advice. All physicians are encouraged / are required to kind of report anything any adverse reaction or any side effect associated with someone recently vaccinated. There's a system for folks to report those, and those providers should know.
Thank you very much.
You're very welcome.
Okay, so anybody else want to, yeah, Mike, go ahead.
Is that me?
Yes, go ahead, yes.
Thanks so much, Doctor. Shelley and Catherine and I and a few others have been on these biweekly updates about both the vaccine and the test and trace program before it. And almost every time we mention Douglas Houses and Wise Towers as appropriate sites to get a big bang for your buck for places to get a lot of folks vaccinated at once, especially given how concentrated the population is. Those are well populated buildings. For the first time last week, we learned that it was actually NYCHA itself that was picking the sites for the pop-up test and trace and the pop-up vaccination centers. Is that your understanding too? And is there some way that we can get our district, and especially our NYCHA facilities, onto the list so that they will be among the next to get the bringing the vaccine to them instead of us going to the vaccine?
So unfortunately, there's a couple different things that are at play here. So the city was able to identify 33 neighborhoods that were particularly affected in the pandemic, and they've been focusing on trying to close the vaccine gap within those neighborhoods. And there's a large disparity or level of inequity where folks living in those regions have not been vaccinated at the rate that other parts. And it just kind of highlights the difficulty and complexity of our city, where you have folks who do live in public housing within a zip code that, as Mr. Fine said, is like good, And I think the plight or the situation of folks living in those regions, it doesn't equal out. And I would say the best way is to talk to elected officials and to get folks in the neighborhood and to rally and support the folks living in those buildings, in solidarity. It's like, we need to get folks in here on the ground. And if it's a community effort to raise those concerns, I think that's how you get folks in these places. Because we do also understand that, living in you can live in a quote unquote good zip code, but still have those, but still be affected disproportionately. But I think that's going to be the best way. If folks want to have a community day, we have you guys' info. I think that's something that can be worked on with elected officials, and we can coordinate that for sure.
Thanks so much.
Okay, I'll give you one more minute for anybody to raise their hand. Robert, okay, go ahead, and then Tony can close it up.
Thank you, Christian. This is a very quick one for Shelley. Is there any murmuring, and really Mark too, is there any murmuring from City Hall on our recommendation for that czar? We hearing anything? We have our ear to the rail at all with that?
They're not going to have, not having a vaccine czar. I think they misunderstood. They're having a recovery czar that doesn't deal with vaccines directly. At least we got
There you go.
one half.
There you go.
It happened in a timely way. So I have a feeling something went in.
Okay.
I saw in the chat, Marie had another question about the agencies not being able to mandate. And I think that also just highlights where we are, it highlights that there are a lot of folks who don't have confidence in a system. And I think we can all kind of see how everything played out over the last year, and a lot of folks don't have a lot of reasons to trust some of these government agencies and other government entities. And I think that just highlights the work that we have to do to get folks who are taking care of folks who are at higher risk because of their age, because of their healthcare conditions. And I think it's conversations like this. I think it's community events. I think it's folks sharing information. It's a lot of things to change some hearts and minds. And luckily, I will say that there's a lot of national surveys and trends. And I think vaccine confidence, as I like to term it, is like improving. And a lot of the groups that are typically highlighted as having hesitancy, there's a lot of acceptance, and people, it's improving. And I think that's really important. And I think it's the biggest message that I have for folks is, if you encounter someone who's not confident or doesn't want the vaccine, at least encourage them to open up their heart and mind to what this represents. Because Mickey said it earlier, this vaccine represents one of our best chance, not the only chance, but one of our best chances for us to have a recovery. We've gotten rid of polio. Over 15,000 little kids a year were getting sick. Some were dying. People were maimed, could not walk, still have lingering effects to this day. And we were able to get rid of polio in the United States and basically the entire world, except for its endemic in 2 places in the Middle East. And then there's, some other, but basically eradicate polio and smallpox and diphtheria and a lot of other things, right? And so this is one of the proven public health interventions that saves millions of lives, vaccines. And this vaccine, we have the potential to do it with this and all of these other things, but it's also addressing some of these inequities and these other things that are causing communities to be disproportionately affected. So it's a bigger effort, and it's a community effort. I think it's those who do have the resources, do have the time to kind of come together and support their neighbors and really try to do that outreach and affect change and kind of get, have policies where we can make so folks can survive and isolate safely until we can get to the other side of this.
Yes, Nikki.
I have a question and two comments. My question, doctor, is what is the truth about how soon you get you're immune after you've had the vaccine?
2 weeks.
Okay, so that was right. Okay, so my other comment is that at Wishfish, we, all the aides, we have almost 90% of our seniors have aides that come in, and all of them got vaccinated through our agency. So I just want to, it's a matter of going a little bit ahead, doing the best that you could with this pandemic, going beyond. We have to go beyond what we're able to do. And so that's Wishfish. And having said that, I'm listening to you, Madeline. I've been struggling with what you're talking about for weeks. And so I'm willing to come in with you and bring resources in to do vaccine trust. And what we have to do is first get O'Donnell to send us the vaccines. And we vaccinate all the leaders first, the people that are well liked in there. And they run around with these stickers, and they begin to, we'll have somebody like the doctors, come in and talk. And then the leaders go in and say, look, I'm fine. I did this. I want to open the city. I want to get back to Central Park. I want to get back with my family. And this is the only way right now that we have to do it. So maybe Shelley, you and I should meet, and anybody else who wants to, so that we could organize that kind of plan. Okay?
Sounds great. I just want to add one thing. I spoke to some people from our houses who were hesitant. They said this was developed last year under that president and is very quick. And my son's a doctor. He said it's been 20 or 30 years they've been developing this science and the research. It didn't happen overnight. They just found the application and how to do it because they have the money behind it. Normally, they don't have the money. So this is long-time research that's been validated repeatedly. And so people, for that reason, should trust it also.
Yeah, we're living in the future, folks, honestly. The fact that this vaccine could be created and it's this safe, this effective, we can make hundreds of millions of doses within this short time. Like, this is what the future looks like. And it's so encouraging that something like this can happen, that we're able to save lives and prevent people from dying, going to the hospitals, severe symptoms. That's amazing. And I think a double tragedy would be if some of our most vulnerable neighbors and friends and family, weren't given this vaccine, or we couldn't do our best, to really convince folks and to listen to folks and hear folks' concerns and try our best to address it. And so thank you very much for having me. I appreciate this. And
thank you.
I really, really, really like this initiative you guys are taking. I think this is how we do it as a community.
And we're going to call it Vaccine Now.
I also want to thank the interpreters that were with us today for the Spanish interpretation, Ana Ruby and Andrea Jurado.
Yeah, thank you so much to everyone. Thank you, Dr. Watkins, for your presentation. Thank you, Mickey and Shelley, for sharing as well. And just want to close by saying we have been dealing with the state, and we have, Douglas was approved in a walkthrough as a pop-up site. It's just a matter of taking that final step to make sure that that is executed. So,
okay.
Thank you. Good night.
Good night, everyone.
Thank you, Dr.